This is the Patient Assessment Management Medical Skill. In this skill, you will have 15 minutes to perform your assessment, patient interview, and voice treat all conditions discovered. You should conduct your assessment as you would in the field, including communicating with your simulated patient. As you progress through this skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example, blood pressure, should be obtained from the simulated patient just as you would in the out-of-hospital setting. You may assume you have 2 partners working with you who are trained to your level of care. They can only perform the interventions you indicate necessary, and I will acknowledge all interventions you order. I may also supply additional information and ask questions for clarification purposes.
You are called to see a 28-year-old female with shortness of breath.
BSI, is the scene safe?
It is.
The nature of illness is shortness of breath?
Correct.
Is this my only patient?
Yes.
I will call for ALS at this time. Is there any indication of trauma?
No.
I will not consider C-spine stabilization at this time.
Noted.
Okay. When I arrive at the scene, I see a young woman sitting on a chair in the tripod position.
Correct.
Hi, I'm Dr. Ewan with Allied. What's your name?
Sarah.
Sarah, how old are you?
28.
And what made you call us today, Sarah?
I'm having a really hard time breathing.
Okay, so we know Sarah is alert, her airway is open, and her chief complaint is difficulty breathing. Looking at how she's breathing, and it looks like she has an increased rate, increased effort with normal rhythm.
Correct.
I will apply high flow oxygen at 15 liters a minute by non-rebreather at this time.
Noted.
And now I'm looking for blood. I don't see any major bleeding.
Correct.
Okay. Is it okay if I check your pulse?
Yeah.
Right. And the rate, rhythm, and quality of the pulse is normal?
Pulse rate is increased with normal quality and rhythm.
Okay. Skin color, temperature, and condition is normal?
Correct.
All right. I think the pulse rate is just up a bit right now because of anxiety and your difficulty breathing. I am not going to treat for shock at this time, but this will be a rapid transport.
Noted.
All right, Sarah, how did this come on?
I woke up this morning and I was just having a really hard time breathing.
Yeah. And does anything seem to make that breathing worse?
No.
And does your chest hurt with the breathing?
It feels like really tight in the middle.
Okay, and does that tightness go anywhere else?
No.
Okay. And is this the worst you've ever been with your breathing?
Yeah, it's never been this bad before.
Okay, so it's pretty severe. And what time exactly did this start?
Right when I woke up, maybe around like 8.
8 o'clock this morning. Okay. Are you allergic to anything?
Yes, to cats.
To cats. And have you been around cats?
Yeah, I'm visiting my friend and I didn't know she had a cat before I got here.
Okay. Are you on any medications?
I'm on albuterol, but I forgot to bring that and my backup inhaler.
All right. And so you have asthma, is that correct?
Yes.
And do you have any other medical problems?
Sometimes I get migraines, but it usually goes away with ibuprofen.
Okay. And when was the last time you had anything to eat or drink?
This morning I had some toast.
Okay. Coming and visiting your friend who has a cat is a new thing for you. Is there anything else going on in your life that could have contributed to this?
Not that I'm aware of, no.
Okay. Do you have any headache or dizziness?
No.
Okay. I need to just shine a light in your eye. Would you mind taking your glasses off for a minute?
Okay.
So I notice that pupils appear normal size.
Correct.
Just look over my shoulder here. And pupils are pearl. I notice the speech and mood appear normal.
She's a bit anxious.
Right. I don't see any JVD or tracheal deviation. Do you have any pain or swelling in your throat?
No.
Okay. You mentioned your shortness of breath and your chest tightness. Do you have any cough with that?
No.
Okay. Is it okay if I listen to your chest?
Yeah, that's fine.
All right, just take some deep breaths in and out for me. Good. One more. Lungs sound clear and equal bilaterally, is that correct?
You hear wheezes bilaterally.
Wheezing. Okay. Sarah, do you have any nausea, vomiting, or abdominal pain?
No.
Any difficulty with diarrhea, blood in your stool, black stools?
No.
Any frequent or painful urination?
No.
Do you have any pain or numbness in your arms or legs?
No.
Okay. I'm just going to check your ankles. Is it okay if I touch your ankles?
Yeah.
I'm just checking for edema,
Okay.
and I don't feel any edema.
Correct.
Okay. I think at this time I'd like to check your blood pressure. Is that okay?
Yeah.
And do you have an arm preference?
Either is okay.
Okay. Okay, I'll just take your arm.
Okay.
I'm just going to clip this on your shirt, okay?
Okay.
Okay, I get 120 on 80.
It is 120/80.
Okay. I'm going to check your pulse. Is that all right?
Yeah.
Okay. Just need your wrist for a minute. Let's do it like this. Okay, I'm getting a pulse of 80 and respiration of 25.
Pulse is 110. Respiratory rate is 34.
Okay, at this point, I would state my field impression, which in this case I think is respiratory distress due to asthma exacerbation, and I would like to call medical control to request albuterol nebulizer.
You are approved.
Okay, and we're giving that at 11:40 a.m. I will then reassess this patient every 5 minutes, rechecking ABCs, vitals, and our interventions. And I am now ready to give report.
Okay.
Okay, Sarah is a 28-year-old female who had onset of respiratory distress this morning. She has a history of asthma and was exposed to a cat. Her allergies are to cats, nothing else. She is on an albuterol inhaler and not currently having access to that because she's from out of town and she left it at home. Her past history also includes migraines, and vital signs were within normal limits. There was wheezes on auscultation to her chest, and she has no edema to her ankles. We did provide oxygen on arrival for her respiratory distress and provided albuterol via nebulizer about 2 minutes ago, and we reassess this patient every 5 minutes.